Hip distraction of the weight-bearing surface caudal glide. It is used for testing, initial treatment, pain control, and general mobility. The patient should be positioned in supine with the hip in resting position and the knee extended. The therapist should stand on the edge of the treatment table, place a belt around your trunk, and then cross the belt over the patient's foot and around the ankle. Place your hand proximal to the malleoli under the belt. The belt allows you to use your body weight to apply mobilizing force. Your mobilizing force shall be applied in a long axis traction by pulling in the leg as you lean backward. In the presence of knee dysfunction, the position shall not be used. Use alternate position. Alternate position also use the same mobilizing force. You just have to apply the force from the femur by placing the hand and belt around the femur and then pulling it. Hip distraction posterior glide. It is used to increase the hip's flexion and internal rotation. The patient should be in supine position with the hips at the end of the table. The patient should also help to stabilize the pelvis and lumbar spine by flexing the opposite hip and holding the thigh against the chest with the hands. The therapist should stand at the medial surface of the patient's thigh. Place a belt around your shoulder and under the patient's thigh to help hold the weight of the lower extremity. Place your distal hand under the belt and distal thigh, and then place your proximal hand anterior to the surface of the proximal thigh. While applying the force, keep your elbows extended and flex your knees. Apply the force through your proximal hand in the posterior direction. Hip distraction anterior glide. It is used to increase the hip extension and external rotation. The patient shall be in prone position with the trunk resting on the table and hips over the edge, and the opposite foot shall be on the floor. The therapist should stand on the medial side of the patient's thigh. Place a belt around your shoulder and patient's thigh to help support the weight of the leg. With your distal hand, hold the patient's leg and place your proximal hand posteriorly on the proximal thigh just below the buttock. While applying mobilizing force, keep your elbow extended and flex your knees. Apply the force through your proximal hand in an anterior direction.